topic for today is about non-vital tooth bleaching. And magpo-focus tayo doon sa endodontically treated tooth na. So, for the tooth discoloration, meron tayong iba't ibang factors to consider. So, unang-una is the etiology. Saan ba or ano ba yung pinanggalingan ng tooth discoloration? Ito ba ay intrinsic or extrinsic cause? Na later on, ma-identify natin yung difference between the two. And then, appearance, doon naman papasok yung changes in color. Is it more on yellowish, grayish, pinkish, or even brown? Depending pa rin kung ano yung factor na pinanggalingan. Next is the localization. Sa localization, is it found at the cervical area, or the middle third, or the incisal? In short, saang area siya ng tooth makikita. Next is the severity. So sa severity, meron naman tayong local tooth discoloration na kung saan iisa lang yung involved, or meron tayong multiple tooth discoloration na kung saan pwedeng maraming tooth involved or teeth involved, and then pwede namang generalized na siya or lahat ay may tooth discoloration. Next is adherence to tooth structure. Sa adherence to tooth structure, nandun naman pumapasok yung saan ba yung kinakapitan or alin ba part ng ipin natin yung nagkaroon ng tooth discoloration. Enamel lang ba yung affected? Or is it between the enamel and the dentine? Or dentine lang ba? Or pareho ng dentine and enamel yung involved. Sa intrinsic causes, pwedeng odontogenesis during the formation of the tooth, nagkaroon ng disturbance, kaya nagkaroon ngayon ng discoloration. Either the primary dentition or the permanent dentition. Next is fluoride. Gaano na ba kadami or nakaapekto ba yung amount ng fluoride na nakoconsume or na-consume na ng patient? Next is tetracycline stains. So sa tetracycline stains, alam naman na natin na dahil siya sa medicine. So usually found siya sa mga bata na yung kanilang parents ay nakapag-take ng tetracycline, or pwede din naman na nabigyan si patient ng tetracycline during yung formation naman ng kanyang mga permanent dentition. So, developmental disorders. So, nandoon din yung makakonsider din natin si odontogenesis. And then, for the trauma, alam naman natin na kung ang ipin ay nakaranas ng trauma, pwede siyang magkaroon ng color changes, lalo na kung naapektuhan na si pulp. Next, aging and pulp necrosis. So, for the extrinsic causes, nandun na papasok yung lifestyle ni patient or ng individual. So, nandyan na yung coffee, teas, wine, stains, the tobacco stains, nandyan din si aging dahil nga sa kanyang lifestyle. Papasok din si diet. Next is the Nasmyth membrane. Si Nasmyth membrane, siya yung covering ng newly erupted tooth. So, as we age, dapat matanggal na siya and dapat ay papalitan siya ni pellicle. So, si Nasmyth membrane, covering nga siya ni tooth, na dapat maalis natin, kung hindi ay magkakaroon siya or madali siyang kapitan ng stains. So, kamukha din ni pellicle, na kung saan pag hindi tayo palaging nagbabrush, pwede siyang kapitan ngayon ng mga stains na nasabi dito sa itaas. Din lang, si classification of discoloration, pwede siyang manggaling kay intrinsic, extrinsic, or combination of both. And pwede din naman siya as a chemical factor na later on ay madidiscuss natin. Okay, so for the etiology, so meron tayong intrinsic stains. So, si intrinsic stains, doon lang pumapasok si pre-eruptive causes at saka si post-eruptive causes. So, sa pre-eruptive causes, nandoon si odontogenesis or yung formation ng ating tooth structure. So, given dyan sa screen ay different factors or examples ng pre-eruptive causes. So, may isa na alkaptonuria. Usually, sa primary teeth lang siya. So, mayroong dark brown pigmentations. So, hematological disorders, nagkakaroon din ng brownish or pinkish pigmentations. The diseases of the enamel and dentine, given na siya sa odontogenesis. And then, the tetracycline stains, na usually, nakaka-affect siya or nagkakaroon siya during pa rin sa odontogenesis. So, here are the examples. On the upper left, makikita natin yung difference ng normal sa ipin na merong amelogenesis imperfecta. Makikita natin yung difference sa color at saka sa structure ng mismong enamel. Doon sa remaining pictures, makikita naman natin yung different stages ng ipin with fluorosis, from mild to severe fluorosis. So, dito naman, makikita natin yung different degrees ng tetracycline stains, which may corresponding treatments sa different degrees, from treatable to non-treatable tetracycline stains. Post-eruptive causes. So, under post-eruptive causes, nandiyan si pulpal changes, na kung saan ang ipin ay pwedeng maging necrotic, na nagkakaroon tayo ngayon ng grayish tooth or discoloration of the tooth. For the trauma, pumapasok pa rin dun si pulpal changes. And then, dentine hypercalcification, dental caries, restorative materials, and dental procedures, and then aging. Caries, nandoon lang siya under the enamel. So, kaya nagkakaroon ng brown or shadow appearance underneath. And then, restorative materials and dental procedures. Alam naman natin na ang amalgam restoration can give a gray appearance of the tooth kapag hindi siya fully varnished. Yung surface, especially dun sa may dentine area. So, extrinsic stains, nandun naman yung ating mga daily acquired activities or daily acquired stains. So, si plaque, na can give us a yellowish appearance of the tooth or teeth. The food and beverages, especially lalo dun sa mga tao na mahilig sa juices, sa acidic drinks na pwede mag-penetrate sa ipin. Tobacco, poor oral hygiene, swimmer's calculus, and gingival hemorrhage. Sa swimmer's calculus, usually swimmers nasa pool yan. Too much contact ng swimmers sa chlorine or chlorinated water, nagkakaroon niya ng whitish appearance yung ipin. Or, pwede din naman na magkaroon sila ng formation ng calcular deposits na due to too much chlorine in the water. So, for the chemicals, yung chlorhexidine stains nagkakaroon ng yellowish brown to brown appearance, metallic stains, copper dust, nagkakaroon ng green stain, iron dust, brown stain, mercury, greenish black stain, nickel, green stain, silver, black stain. Moving on, for the bleaching, so it is a procedure done in lightening a tooth or the teeth of an individual. So, gumagamit tayo ng application ng chemicals sa ipin so that i-oxidize niya yung organic pigmentation ng teeth. So, for the indications, we have discoloration of the anterior teeth, tetracycline stains, fluorosis, hemorrhagic discoloration, medication discoloration, aging discoloration. Okay, poor case selection. So poor case selection, hindi naman siya patient factor, kundi sa ating mga dentists. Kasi, during the interview, malalaman naman na natin kung ano yung lifestyle ni patient. For example, gusto niya ng bleaching, pero upon interview nalaman natin na meron pala siyang lifestyle na kung saan palagi siya nag-wine, nagko-coffee or tea, nagagamit din siya ng cigarettes, and then meron pa siyang habit of chewing betel nuts. So, i-consider pa ba natin yung factor na yun prior to bleaching procedure? Dapat isipin natin if kakayanin ba ni patient panindigan yung aftercare ng ating bleaching procedure. So, alam naman natin na bleaching is for aesthetics, and alam din natin na bleaching chemicals has further effects on the tooth. Hindi lang siya nakakapagpa-whiten, but nagkakaroon ng changes sa tooth structure during bleaching procedures. So, sa poor case selection, dapat hindi lang puro money matters when it comes to bleaching procedure, but dapat i-consider din natin yung magiging effect not only on the patient. Sa poor case selection, madami tayong dapat i-consider. Hindi lang tayo basta-basta mag-bleaching. Next is dentin hypersensitivity. For all, alam naman natin lahat na si bleaching, meron siyang effects of sensitivity. Especially during the whitening procedure or the bleaching procedure. So, if alam naman na natin na super sensitive or nangingilo na yung ipin, why are we going to subject it to bleaching? Na saan pwedeng si vital tooth ay mas iti-trigger pa natin yung kanyang sensitivity. Pwede mag-cause ng pulpal necrosis. So, extensively restored teeth. Sa extensively restored teeth, lalo na yan, i-consider natin is the anterior teeth. So, the anterior teeth, alam naman natin ay dapat aesthetically pleasing. So, if yung anteriors niya ay meron ng restorations, mako-consider pa natin yung small restorations for bleaching kasi kaya pa natin siyang ihabol. Pero for extensively restored teeth, i-consider na natin yung materials to be used upon after dun sa bleaching procedures. The teeth with hypoplastic marks and cracks, it is a sign na weak na yung tooth structure niya. So, further bleaching it may cause further destruction of the tooth structure. And also, dun sa cracks na yon, pwedeng mag-seep in yung mga chemicals. If vital pa siya, pwedeng mag-cause ng pulpal necrosis. So, next is defective and leaky restorations. So, sa defective and leaky restorations, doon pa din papasok like si micro cracks na kung saan pwedeng mag-seep in pa din si chemicals dun sa defective or dun sa defective restoration and can cause further destruction pa din dun sa tooth structure. So, next is an ideal bleaching agent. So, an ideal bleaching agent, it must be easy to apply sa ipin. Given na dapat i-cover natin or i-protect natin yung surroundings ng ipin, like the gums, but the bleaching agent itself must be easy to apply. So, it lightens the teeth efficiently. Dapat yung pipiliin nating bleaching agent, nakakapag-whiten agad siya or may effect agad ng whitening doon sa teeth involved. Kasi further repetition of the procedure can further cause still the destruction or pwedeng masira yung ating tooth structure. So, doon din papasok si required minimum quantity to achieve dental results. So, mas mas kaunti, mas effective, mas maganda. Kesa naman yung ang dami-dami mo nang ginamit na chemicals or the bleaching agent, yet hindi mo pa rin na-achieve yung desired results mo. Nakakos ka lang din ulit ng destruction or irritation doon sa tooth or sa ipin. So, the bleaching agent must not irritate or dehydrate the oral tissues. So, ang bleaching agent, before we apply, gagamitan pa rin natin ng barriers, especially yung gums. And we must know how to isolate so that pagka nagkaroon na aksidente na may tumulo, hindi masyadong makaka-affect or makaka-irritate sa oral tissues. Also, dapat hindi din niya ma-dehydrate, for example, si dentinal tubules, na kung saan pag masyadong dehydrated, pwede mag-further cause ng sensitivity post-procedure or post-treatment sensitivity. So, the bleaching agent must not cause damage to the teeth. Even though na yung bleaching agents, nagkakaroon siya ng minor effect on the tooth structure, but still we are using fluoride para ma-protect pa rin yung ating tooth structure, but then it must not damage the teeth of the patient kasi ang focus natin is for the aesthetics and not destroying the tooth structure. Constituent of bleaching gels. So, ang bleaching gels ay mayroong main components and it came from the peroxide family. So, meron tayong carbamide peroxide, hydrogen peroxide, and sodium hydroxide, and sodium perborate. So, meron din tayong other ingredients like thickening agent like carbopol, urea, the surfactant, preservatives, vehicle, flavors, and fluoride and potassium nitrate. Hydrogen peroxide is commonly used in the in-office bleaching technique, and it has a concentration of 25 to 38%. And ginagamit din siya as a home bleaching technique or walking bleach technique with a concentration of 3 to 7.5%. Too much hydrogen peroxide can cause severe sensitivity, gingival irritation, and enamel breakdown. For the carbamide peroxide, we have a urea hydrogen peroxide on its other name. Bifunctional derivative of carbonic acid. For home bleaching, it has 5, 10, 15, and 20% concentration. In the in-office bleaching, the 35% carbamide peroxide was used. Hydrogen peroxide and urea is its component in aqueous solution. Sodium perborate has 95% perborate. Its components are sodium metaborate, hydrogen peroxide, and nascent oxygen. Sodium perborate is usually alkaline during its preparation, and it is commonly used as an intracoronal bleaching agent. For the bleaching mechanism, we have redox process. So, si oxidizing agent, meron siyang free radical na mayroong unpaired electrons. So, pakakawalan niya yon ni oxidizing agent yung kanyang free radicals. So, magiging reduced na siya ngayon. So, the reduced agent, magtatanggap naman siya ng pinakawalang electrons at magiging oxidized na siya. So, to make it simple, before bleaching procedures, i-consider natin si tooth as our reducing agent. And the bleaching material will be our oxidizing agent. So, after the treatment, nagkaroon ngayon ng release of electrons, nagkaroon ng acceptance of those electrons. So, i-consider na natin ngayon si tooth as the oxidized agent, and then si bleaching material na ngayon ang ating reduced agent. Kung hindi pa rin natin na-achieve yung ating desired results, we can repeat the procedure. After the dental bleaching procedure, it is said that nagkakaroon nga ng cleansing ng tooth structure because nagkakaroon ng oxidation ng mga organic pigmentations sa ipin. So, nagkakaroon din ng temporary dehydration ng enamel surface during the bleaching procedure. Kung saan, manonotice natin na after dental procedure, napaka-white nung ating surface. But then, after recall, manonotice natin na magkakaroon ng little changes. Magkakaroon ng yellowish or somehow or malilipat ng isang step sa ating shade guide. So, magkakaroon na tayo ng changes sa ating enamel surface because acid nga siya or chemical siya, magkakaroon siya ng effect dun sa ating tooth surface. So, for the intracoronal bleaching of endodontically treated tooth, meron tayong two method na usually ginagawa. It is, ang una ay walking bleach and pangalawa is the thermocatalytic technique. For the walking bleach technique, sodium perborate ang common na ginagamit as bleaching agent. And lalagyan muna natin ng calcium hydroxide, deepest pa doon sa ating CEJ or near doon sa ating gutta perca dahil endodontically treated tooth na siya. Para lang iseal at hindi pumasok yung bleaching agent doon sa ating apical portion. So, required si patient bumalik weekly para palitan or ma-check kung na-achieve na ba yung results na gusto nating i-attain. And then, if composite restoration ay nag-discolored siya, nire-require na magkaroon na external bleaching. And for the in-office non-vital bleaching technique, we have thermocatalytic technique. In thermocatalytic technique, it uses 30 to 35% hydrogen peroxide in liquid sa pulp chamber. So, after nun, gumagamit ng heat application using an electric heating device. Hindi naman siya usually or hindi na siya common ginagamit dahil nagkakaroon ng potential cervical resorption dahil doon sa heating process. Meron din mga journal reports na nagsasabi na may isang technique na pwedeng gamitin which is the ultraviolet photooxidation na kung saan mayroong 30 to 35% of hydrogen peroxide on the pulp chamber. And then, pag-a-apply nun, gagamitan naman ng ultraviolet light doon sa labial surface ng ipin. Yung bleaching procedure niya, manggagaling siya intracoronally. Hindi lang siya external. Okay. So, adverse effects of bleaching agents or bleaching procedure on an endodontically treated tooth. So, pwede magkaroon ng external root resorption, chemical burns, Sa kadahilanan na pwedeng hindi fully sealed yung ating intracoronal filling, na kung saan pwedeng mag-seep in yung chemicals palabas sa apical foramen, and pwede nyo yung maka-irritate doon sa surroundings ng ating ipin. So, inhibition of resin polymerization and bonding strength. So, for the restoration of endodontically treated tooth, dapat magpalipas muna tayo ng 7 to 14 days after the bleaching procedure para mabigyan pa natin ng time yung ipin na if magkakaroon pa ba siya ng changes after that procedure. Kasi nga, diba, dehydrated si enamel surface. Ngayon, after enough days, re-rehydrate na ulit si enamel, and then lalabas na ngayon kung ano yung tunay na shade na kinalabasan ng ating bleaching procedure. So, dapat daw ay gumamit tayo ng lighter shade na light cured acid-etched composite resin sa ating restoration. Dapat sinasuggest din na maglagay tayo ng white cement under or beneath that composite so that hindi lang translucent or hindi maging translucent yung magiging kulay ng ating composite, kundi pwede nating ma-match si composite or si final restoration doon sa final product ng ating bleaching procedure.
For our journal, yung topic namin is about bleaching of non-vital teeth, 5-year follow-up case reports.
Introduction. Tooth dyschromias constitute a clinically visible deviation from the normal dental contour. So this creates an aesthetic problem that become a great concern sa mga patients. So they are classified as either intrinsic at extrinsic. Sa intrinsic, yung sa mga drugs, iatrogenic factors, sa aging, tsaka traumatic factors. While sa extrinsic naman, affect the external surfaces of the teeth and may be results of habit, diet, or both. Dental bleaching is one of the alternatives used today to improve the aesthetics of discolored teeth. So it is considered a conservative clinical approach where yung chemical solution or yung bleaching agent is applied sa surface of the interior tooth. This procedure involves placement of chemical oxidizing agent within the interior portion of the tooth to remove the discoloration. So, meron dalawang bleaching agent na ginamit, yung sodium perborate or perboric acid, tsaka carbamide peroxide or urea peroxide. So, yung sodium perborate, most trusted among dentists for use as an internal bleaching agent. While naman yung carbamide peroxide, most widely used siya sa dentistry for external dental bleaching. Materials and methods. So, merong 45 volunteer patients participated in this study, pero 13 patients lang met the requirements to participate in this study. Pero merong isang patient na 2 beses siya na root canal, so counted din siya in making a total of 15 treatments. Their chief complaint was the presence of tooth with a darker shade than that of their other teeth. So all of the patients revealed a history of dental trauma and were diagnosed with non-vital teeth with traumatic dyschromias. The 15 teeth to be treated were divided into 3 groups. Group A, Group B, tsaka Group C. Sa Group A, sodium perborate plus distilled water. Tapos nag-change siya every 7 days with a total of 3 to 4 sessions. Sa Group B naman, 37% carbamide peroxide gel and change every 7 days with a total of 3 to 4 sessions. Sa Group C naman, 37% carbamide peroxide gel and change every 4 days with a total of 3 to 4 sessions. Bleaching technique protocol. So una, diagnosis and treatment planning. And then oral prophylaxis para ma-register yung initial tooth color according to the Vita Color Guide. Tapos tooth isolation to protect the adjacent structures from the bleaching agent. Then reshaping of access cavities so pulp horns or other hidden areas can be properly exposed and cleaned. So para ma-generate yung space for the application ng cervical sealed material, tsaka ma-expose yung dentinal tubules for the application ng bleaching agent. So sunod, reduction of root filling, 3 mm in apical direction from clinical crown height, tas application of mechanical cervical seal in the form of a 1 mm coltosol cap with a layer of light curing glass ionomer cement placed upon it para minimize yung leakage of the bleaching agent. Sunod, acid conditioning with 37% phosphoric acid for 30 seconds para ma-remove yung smear layer and to open the dentinal tubules. Then, application of bleaching agent. Sa group A, sodium perborate was triturated sa glass slab and distilled water was added. Sa group B and C naman, 37% carbamide peroxide gel was applied to the pulp chamber without touching sides to restore the lingual access. And then temporary filling with coltosol, and lastly, occlusal adjustment. Follow-up appointments. Each treated tooth was evaluated and the results were recorded according to the Vita Color Guide. And then the teeth were photographed to capture the sequence of color changes. When the tooth reached the desired color or bleaching limit, the temporary filling was removed and pulp chamber was irrigated with water to eliminate the bleaching agent. This process is necessary for groups B and C to allow for the placement of calcium hydroxide, paste, and water, which remain there for 10 days to neutralize pH. After 10 days, the calcium hydroxide was removed and then proceeded to the final restoration of composite by incremental technique and with care taken to prevent premature occlusal contact.
So results, 5-year follow-up methods. So after 5 years, yung 13 patients were called to assess their periodontal health and possible presence of cervical tooth resorption. Pero 4 na patient lang yung bumalik. So clinical case number 1. So before, yung tooth color niya is A4. Then after ng 4th session ng tooth bleaching, naging A2 siya. Then after 5-year follow-up, yung shade pa rin niya is color A2. Tapos, ito yung x-ray evaluation at 5 years follow-up. Case number 2. So, before, yung shade ng ngipin niya is color A3. Then, after niya ma-toothbleach, naging A1 tsaka A2. Or after ng 5-year follow-up check-up niya, yung shade ng ngipin niya is naging A3. Hindi siya katulad dun sa clinical case number 1 na maayos yung pagkaka-toothbleach niya. Kasi hindi nag-regress yung discoloration. Dahil kasi dito sa clinical case number 2, yung restoration niya is defective and yun, kaya nagtuloy yung regression ng tooth discoloration.
So, yung sa first clinical case naman, na-preserve naman yung desired aesthetic color niya, even though yung patient reportedly occasionally drinking coffee and smoking. Pero, yung final restoration made after the internal bleaching was in perfect condition. Hindi katulad nung sa second, third, and fourth clinical cases, where yung restorations nila ay defective tsaka regression ng dyschromias were observed. Although, in these cases, yung 3 patients na yun reported the absence of habits like smoking and coffee consumption. Hindi katulad dun sa unang patient na preserve pa rin niya yung kulay ng ngipin niya kahit na umiinom siya ng coffee and nag-i-smoke. So, they have suggested that the internal tooth bleaching procedure would have to be repeated to maintain the desired aesthetic color.
So, discussion. The use of foaming bleach technique for the management of discolored endodontically treated teeth can be safely done. Then, conclusion. In this follow-up study, yung 4 cases ng non-vital tooth bleaching were evaluated. And then yung tooth discoloration niya tend to return after non-vital tooth bleaching. So para nga ma-maintain yung kulay, the bleaching procedure must be repeated para makuha yung desired color niya. And when non-vital bleaching treatment is performed correctly, it can be used as an effective and safe post-endodontic treatment for discolored anterior teeth. The longevity of a non-vital bleaching is directly related siya sa quality of the final rehabilitation after the internal dental bleaching treatment, thus quality of patient care at home, tsaka yung patient's commitment to keep the follow-up appointments with the dental care provider.